Good afternoon, everybody. This is a Thursday, July 16th health meeting. Just let me remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor March 12th, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link may be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click and raise a hand button if they wish to speak. The chair will call on those who have raised their hands in the order they were raised. If you do not have audio capable device, the question and answer button can be used to type a question. YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. For meeting purposes, can I get an attendance by roll call? Malcolm McNabb?
Yes.
Jimmy Cooper?
Here.
Meredith Lepre? Melissa Murphy?
Here.
And Steve Visco is present. So, public comment, do we see anything yet? I don't think it.
We have a public comment from Megan Perry. Megan, I think your microphone should be live now.
Can you guys hear me?
Yes.
Awesome. Thank you so much. I'll be super short. I'm sure you guys have all heard or seen that Dr. John Kuhn will be giving a presentation on PFAS on Monday. And I just wanted to make sure that the board was aware and it's open to the public. So everybody's invited to attend. Channel 18 will be running it, for lack of a better term. So there's no limitation. I know last night at the select board meeting, it was mentioned there might be a limitation in number of people that could attend, but there should not be a problem now. And it's just a open meeting about PFAS. He's presented before about 2 years ago on PFAS. If anybody would like to see that presentation, I'm happy to share that to you. Or if you have any questions for him or want to speak with him, I'm happy to connect you guys. Thank you.
Can you give a time and date on that again?
Oh, absolutely. I'm sorry. It's July 20th at 6 p.m. And if you go to, it's being sponsored by Nantucket Tipping Point. If you go to Tipping Point's website, there's a sign up for it under the PFAS section of the website. It also has all the previous documentation on PFAS that Dr. Kuhn's done and some other stuff that we've collected along the way.
Perfect. Thank you.
Absolutely. Thank you.
Thank you. Roberto, do you want to follow this agenda, how it's written?
Sure. So we can do the director's report is technically next.
Okay.
One of the things with the director's report is, so I gave a quick presentation yesterday about the sewer presentation. So if you want me to go over that again, I can. But really what it comes down to is what we're looking to do is we've written a grant to the Community Foundation, which they are looking at favorably, but they are asking for more information so that we can expand the sewer testing to include weekly testing for Sconset and the Surfside treatment plant. It is known to be very effective at predictive case spikes. So we are going to be using that to look forward to. One of the things that we've had a request on, I received a request from DPW director earlier today, and it was mentioned to me last week, is if we can expand the order number 12 to include the MRF, the drop off for the landfill, to require masks at the landfill. I don't see a problem with that, but it was definitely the board's decision. And one of the things that we would like to do is also get that through both boards. I know last time we did it as an emergency, but we also want to include the select board because this is it's working. So expanding the mask order to the landfill would also make sense because there's a lot of clashes that are starting to happen there on the weekends. So I would suggest that we expand that order. If you would like, we can, I think because it's a last minute thing, I think there's an exemption to the open meeting law to add that to the end of this agenda, if that's okay. Or what we can do is we can schedule a meeting again for maybe next week, a very short meeting after the select board when we can discuss it and we can vote it in. I want to leave that up to the board.
Thank you. Through you, Steve, I have a question. Roberto, can the DPW not make their own rule that masks are required on their property? Does it need to be an emergency order?
Unfortunately, the group that is responsible for the landfill is Waste Options, which is not part of the town. And then the Board of Public Works is actually the select board. So the select board would have to post a meeting as the Board of Public Works to do that. Considering we already have the order there, it would just be an expansion of our order. Is the only reason why I would see us doing it. So other than that, Steve, I would like to I know we have that executive session at 5, so I don't want to take anyone's time.
Yeah. What's the rest of the board feel? You want to just, Malcolm?
Well, excuse me. First, I'd like to welcome our new members.
Absolutely, yes.
And you're certainly welcome to this board. And I don't see why we can't just expand today.
I would agree with you, Malcolm. My sense is that our initiative did work and accomplished I think the most important goal of increasing mask usage, but also in supporting the business community's efforts to require masks. And so if that would both be accomplished by expanding the order to the landfill, I would support that.
The mask order is definitely working. The fact that we didn't see 15 cases over the weekend with the what some would call the insanity we saw on the July 4th weekend is just a testament to how well that order is working. So I would leave it up to the board if you want to make a motion or anything like that.
I move that we expand Order 13 to include the landfill.
I'll second that.
All in favor by roll call? Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Meredith Lemprey,
Yes.
Melissa Murphy,
Aye.
and Steve Disco says yes.
Excellent.
Was that it for your report, or do you have, okay,
I want to just leave that at that just so that we can keep it moving.
right. Election of officers.
Okay, so now that this is our first meeting afterwards, it's time that, so Meredith and Melissa, like Malcolm said, I'm remiss in that. Thank you for volunteering to be on this board. It's great to have both of you here. And the first order of business in the new year of new membership, we now have to elect officers. So we need to do a motion of.
I nominate Steve Visco for chair.
I'll second that immediately.
Okay, well, thank you. I appreciate the confidence. So, okay, all in favor by roll call? Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Meredith Lemprey,
Yes.
Melissa Murphy.
Yes.
Yeah, I guess
With gratitude. Thank you, Stephen. You've done a great job.
Thanks, everybody. Okay, vice chair.
I nominate Malcolm.
I'll second that.
Okay, all in favor by roll call vote? Jim Cooper,
Yes.
Meredith Lemprey,
Yes.
Melissa Murphy.
Aye.
Steve Isco says yes. And Malcolm, give yourself a thumbs up.
Congratulations.
Thank you.
Thanks.
Okay.
Review of the minutes, June 18th, 2020 and June 29th, 2020. Is any, yeah, Melissa?
I'm sorry. I did have one quick question for Roberto and his director's report, if you don't mind.
Yeah.
Roberto, would it be possible to get some information either out to the board or concurrently to the public when we do get new positive cases? I think not, deep demographic data. I think this board has discussed, and you've had those conversations, but I think I'm getting a lot of feedback from the community about how the disease has been transmitted. You and I spoke about this a little bit last night at the select board, if it's community spread or travel spread, and then just, some quick update on how the contact tracing efforts are working. I don't think that we need details on that, but I think it would go a long way to assuring the community on how these new cases are coming to the island. But I don't know what your thoughts are on that, and obviously the rest of the board. Thank you.
So one of them is we're not releasing a lot of the demographic information because Kevin Cranston at the Bureau of Infectious Diseases at the state specifically asked us not to. The fact that some boards of health are doing that's actually against the request, because he can't order us to not release that information, but he can suggest it, mainly because he's been seeing in other towns what, quite frankly, we're already seeing here, where as soon as demographic information starts getting released, even if it is something as this is an off-island person or something like that, you start getting, for lack of a better way, a lynch mob. And based on the messages that I receive and the messages that I've been getting through social media and things like that, releasing the demographic information would probably be more deleterious than helpful. My question back to those who are asking for demographics is, how would this change your behavior if you knew? We have to act like everyone has it anyway, because these masks orders, these orders are in place to protect everyone. If it's not our time to let our guard down. So if we just start releasing information, how would that change behavior? We've done very effectively at changing the behavior for the better here, and releasing information that may contribute to an us and them mentality might actually be quite dangerous. And I don't know what the board thinks about that.
I agree.
I agree as well. I think you said at one point that when we had a big spike from July 4th, that a lot of the cases came here. And I think for me, I think that was reassuring to people that you knew that this wasn't community spread.
As soon as we get community spread, we'll let everyone know. Right now, everything has been in isolated pockets.
Thank you. I agree, and I appreciate your feedback on that. I felt compelled to ask and have the conversation sort of restated again publicly, but I do think that also when we start to see increases in community transmission, that may change some people's behavior, even though we should have the same behavior out of the gate. So thank you. And thanks for letting me ask that.
Thanks. So we'll move on to the minutes for June 18th, 2020, June 29th. Any corrections, additions? No?
I'm good.
I got a motion to accept the minutes.
I'll make that motion.
Take a second.
Second.
Call vote. All in favor, Jim Cooper. Malcolm McNabb.
Yes.
Meredith Lepre.
Yes.
Melissa Murphy.
Yes.
And Steve Visco says yes. Minutes are approved. Loan request. One thing I point out on this loan request, 24 Gulfview, I think the address is actually 18.
Okay. I'll have to take a look and get that fixed for you.
Yeah, I think 20. Yeah, I think pretty sure it's 18, not 24.
Okay.
But it's the Perkins. I know the families, but
Yeah, so I'll just fix that. It should be correct in the paperwork. We just may have just posted it in the packet incorrectly. My apologies.
okay.
But we have no objection to either of the two loans on the agenda today. So we recommend passing.
So making a motion to approve the Gulfview Drive loan.
I'll make a motion to approve that.
Second.
I'll
Second.
second it.
Okay. All in favor by roll call. Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Meredith Lepre,
Yeah.
Melissa Murphy,
Aye.
Steve Visco says yes. Second loan request for 13 McLean Lane. It's a septic to sewer connection.
Yes. So this was part of the fill-in parcels when we had the sewer. We called those the plus parcels. When the sewer was passed, sewer's available. They just need to abandon their system and connect. We have no objection.
A motion to approve that loan.
So moved.
A second.
I'll second.
Okay. All in favor by roll call vote. Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Steve Visco says yes. Loans are approved. Next, variance request for 167 Raw.
Yes. So this is a variance request that they're asking so that they can accept food deliveries at 167 Hummock and not have to use the commercial kitchen that they're leasing for the food truck, 19 Nobodier Farm. This is a group that we have seen before with similar reference variance requests, and I believe there was a staff recommendation that you received that should be in the packet as well. And then also Artel is here to provide his side. So Art.
Can you hear me?
Yes.
Okay. Does the applicant want to speak?
I don't see him in attendance.
Okay. All right. So I just want to give the board an overview on how these licenses work. So 167 Hummock Pond has a retail food permit. Retail food permits allow for sale of filleted fish. They can butcher fish there as well. Shellfish, lobsters, crab, and prepackaged, commercially wrapped goods or foods. A retail food permit does not allow for food preparation, doesn't allow for making of coleslaw, potato salad, hamburgers, sandwiches, salads, things like that. To do prepared foods that I just listed, you would need a food service establishment permit from this office. We can't issue 167 Hummock a food service establishment license for two reasons. One, their septic system isn't large enough. And two, their retail seafood operation would have to be separate from the food prep. So to accomplish providing prepared foods at 167 Hummock Pond Road, they have rented a compliant kitchen at 19 Nobodier Farm to do this, to provide food to the market and the food truck there. That said, we've had repeated issues with this organization preparing food at 167 Hummock Pond Road. We've had to pull the food truck license a couple of times because of their failure to comply with the licensing requirement. Their past has demonstrated an unwillingness to comply, and we've spent way too much time dealing with this issue. It's very simple for them to, prepare food over at 19, which they're on track doing now. But food is to be delivered to the proper base of operations for basic food safety. So for immediate refrigeration, prevention of temperature abuse, and unnecessary handling. There's no need to add another step to the whole process. So granting the variance, we think would encourage continued non-compliance. And receiving food anywhere other than the base of operations is a poor practice and only opens the door to future problems. So we recommend denying the variance.
Anybody have any questions for Art? Seeing none, is Jesse there, or the?
No, we don't see Jesse or Ashley here. They were sent the Zoom link earlier today. And if the board wants to take action, the board can definitely take action. This is a variance request. If you want to wait until a time that they can become available, we can table this till next meeting. It is whatever pleasure of the board.
I'd like to make a motion to deny the request.
A second.
Second.
All in favor by roll call vote to deny the variance, Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Steve Isco says yes. Variance is denied. Okay, next. Open continued public hearing.
Yes, so we continued the public hearing for the Nantucket regulation. We would need to open the hearing first, and then I can share my screen to show you the changes.
Motion to reopen the public hearing.
I'll make that.
Second.
Second.
Okay, by roll call vote, Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
and Melissa Murphy.
Aye.
Steve Isco, aye. The public hearing is open.
Okay. So what you should be seeing now is the regulation with the proposed changes. Mr. Greeter actually connected with us earlier to mention how at the last meeting there were two other changes, substantive changes that were also suggested. They are here. Unfortunately, they were not in the ones that I posted in the packet. So I'll run through the three changes. The first change that you'll see is the original order had these bounds on here that showed the center of Hither Creek to the Cambridge Street to Nantucket Harbor. So we changed it to be defined by the GIS map titled Nantucket Harbor Protection District. And then I also have the website available for the document. We have the document as part of the packet as well, which will be appended to this as Appendix A. The next change to the Nantucket regulation is the section 5C, where we're adding that all conventional septic systems located within Nantucket Harbor Watershed Protection Zones District A and B shall be inspected every 5 years from the date of these amended regulations, and inspection reports shall be filed with the Nantucket Health and Human Services Department. This mirrors the same language. This language is copied and pasted from the the Nantucket Harbor Watershed regulations, so it'll be consistent on the two regulations. And then the last change is this section 6C that says no system serving new construction as defined by regulation 50 shall be designed to receive or shall receive no more than 110 gallons of design flow per 10,000 square feet of contiguous lot area. This is also the same as the Nantucket Harbor Watershed regulation. So those are the three only changes. I know that there may be some public comment. This is a public hearing after all, but as we go, this is what we have. So I imagine that we can discuss with the board first.
Okay, on that C one, with the 10,000 square feet, and that is, that's whether it's a, like Nantucket, that's whether it's an IA or not. So there's no IA credit except in a non-nitrogen zone. So,
Correct.
okay, I just wanted to make sure it's the same.
Correct. So this also specifically calls out contiguous lot area. So it has to be, 40,000 square feet an acre, 40,000 square feet together is only limited to 4 bedrooms. It can't be a 20,000 square foot lot and then somebody else's lot in between and then another 20,000 square foot lot. It has to be contiguous because we've seen that sort of finagling around, and DEP has specifically said not to allow that. So we've put it in here. So the word contiguous has been added into this as well.
Are there any legal lots out there that are less than 10,000 square feet?
There are a few that are out there. I believe that they're still unbuildable because they're less than 10,000, but there's that. This is the conversation that if the sewer does come out there, will that become available for construction if sewer to show up? And I believe that's a zoning question because our regulations would no longer.
Okay, thank you.
I'll add one, we know that there's a couple in Fisher's Landing, but we gave them some exemptions on the half-acre lot, and I think there's maybe 1 or 2 10,000 square foot lots left in there.
Yeah,
Right.
that'll do their aggregation. Yes.
Right.
And then I know there's a public comment as well. So as soon as so Steve, you want me to put in the public comment?
Sure.
Charlie, you should be good. Charlie Sai, I think you're still muted. Charlie?
Okay, this is Charlie Stott, co-president of the Nantucket Conservation Association. And I believe that at previous Board of Health meetings, Nantucket Conservation Association leaders expressed concern about the financial impact on owners who have recently repaired or replaced their Title V systems and could be subject to the additional expense of installing an IA system. At its April meeting, the MCA Board of Directors approved a motion to ask the Board of Health to grant a 20-year delay to an owner who invested in a new Title V system. The MCA proposal is particularly important if the town's sewer system should be extended to Nantucket. In that event, some owners could be subject to the expense of a recent repair or installation of a Title V system, then a replacement with an IA system if, for example, they seek to add a room to the house, and then a requirement to connect to the town sewer. So we would ask that you consider amending the regulation to provide financial relief in circumstances such as what I've just described. And thank you for your consideration.
Thank you, Charlie. And board?
Well, I'd like to refer to Art on some of that. With the regulation in, you right now, if you had to put an IA in, you get a 10-year exemption. So if somebody wanted to, somebody years ago repaired their conventional system and then actually, a few years down the road actually has room to add another bedroom to the property, that would, like 64, it's going to trigger you upgrading the system. So sewer's not on the, it's in the back seat right now. So we've been kicking this can down the road for a long time in Nantucket. It's been years. So this is one of the reasons to get this regulation in there. We know it has some bite, but it works. It's been working in Nantucket Harbor, and there might have been a little reluctancy at first, but I haven't seen any other issues in the last 5 years since we instituted it. So anybody down the road can come to the board and ask for any type of variance, and we would take those on case by case, I would think anyways, like we always do.
Yes, and we currently have that blanket 10-year variance as well. Okay, and there's a second public comment as well from Leslie. So, Leslie Forbes, you should be up.
I think I'm unmuted. Can you hear me now?
Yes, we can.
Okay, so I have not seen 501.04 letter C before about the 110 gallons per 10,000 square feet. That, as I recall, mirrors something that was put in years ago by Richard Ray when water was coming out here. Is that true?
I believe so. I believe that's correct.
So the implication of that is that a 1 acre lot can have a 4-bedroom home, correct?
Yes, 1 acre being 40,000 square feet. Yes.
Okay, thank you. I appreciate that. The second thing is in 551.09 enforcement, you refer the reader to local regulation number 67. And I'm just a stickler for editing and helping readers get through things. I would appreciate it if you cut and paste the information, the pertinent information from regulation 67 and put it in there rather than asking the homeowner to flip from one regulation to another and interpret both of them. It just would be a convenience and I think the right way to do things. You also refer to regulation, there's another regulation you refer to without actually lifting the words. You know, there have been plenty of times where the whole regulation doesn't convert and you're leaving it, I think it leaves it open to interpretation and extra work on the part of a person who's trying to obey the law. So my suggestion would be to cut and paste from the other regulations what is pertinent to regulation 51 and add them in rather than asking the reader to find regulation 67 and the other one and figure out which parts apply. So that's my second request or suggestion from a public point of view. Another sort of stickler thing is that the current signature page on this has different people on it in different positions than we currently have. I think they were accurate as of 2017. And I don't know what the appropriate and legal way is to make it accurate for when you vote this amendment. Which leads me to the next point of when the heck is this thing effective? I had heard via the grapevine that it's already being enforced for new construction, and yet I have not found any evidence of the board actually having voted to put this into effect. And you know that I've been following Board of Health packets and meetings quite regularly. And looking back through the minutes and such, I can't find anywhere where this was actually voted to take effect. So is this in effect now or not? That's question number 2.
Okay, so I'll take those one at a time. So as far as, let me just confirm here, the regulations. Trying to remember where exactly it was that we voted. I have the I have the minutes somewhere. I'm trying to find them right now. As far as the regulation 67 goes, this is regulation 67 here, which is the enforcement provisions. It's just the process of how we enforce administrative appeals, hearings, how to appeal the penalties, and how to do variances. All of this is actually affects regulation 51, sorry. In order to copy and paste this into the regulation would add another 4 pages. So what we're doing by adopting it by reference is actually recommended by town council on how to, so in order to avoid a 30-page regulation. Regulation 50, which is also adopted by reference, which you see above here in one of the groups, is actually just the definitions regulation. So when we adopt by reference, if we ever have to change a definition, we just add it to regulation 50 because it's just a list of definitions. As far as the signature page goes, we actually append as the amendments happen. We add a new whole page of signature pages at the end in order to show each individual amendment. So when the amendment was adopted on, as you should see it on the screen, on February 16th, these were the signatures that were shown. And then if we adopt it again, if we do an amendment today, the next signature page will show the current creation of the board with the amendment date on it. And then there was a third question. Leslie,
The implementation
date.
Yes. So with any amendments that we do today, we have to vote in a new implementation date as well. So you'll see where it says amendment adopted and then amendment effective date. So what's been happening is we did create an amendment effective date in one of the votes. I'm trying to find those minutes as we speak so that I can display them on screen. We did do a vote and they had a implementation date of July 1st, which is why you see it on the screen. And then what we did was we had it created, but we also put in the public hearing for this, I believe it was December 18th of 2019. And in that agenda, we also created this hearing that was supposed to continue to January so that we can do a final adoption date with the amendments, which was killed by COVID. So that's kind of the reason why you see some of the minutes being a little wonky. So I'm trying to find the actual vote for us, and I can post that as we go along.
Thank you for that explanation. And I understand, far be it from me to make a regulation that's 30 pages long. I don't think that's a good idea. So I appreciate that. Cleaning up the actual date that it's implemented is important to people. So, and as I said, and that moves to the final question I have, which is, as someone who follows town government and tries to follow the laws as I know them, we have spoken with several people, and while the Nantucket Conservation Association has stayed on top of this, not everybody does. There aren't that many people out there who take the time to read Board of Health information packets. So my very strong recommendation, having been in the change management business for some number of years, is that you alert the public about this change, because it's likely to be a very expensive change. It's going to change people's planning and it's going to change their thinking. It's quite a difference. And you've done a very good job of communicating regulations as far as emergency order number 1, number 10, number 12, et cetera. So you have a mechanism in place to alert people. And I it's going to come as a big surprise to a lot of people should they want to put an addition on or sell their house, that there are these septic regulations that happened and they knew nothing about them. And they're going to think, oh, dark of night, this happened. Well, we all know it didn't happen in the dark of night. It's been in process for a very long time. And we do our best to get the information out, but we're not everything. So I would recommend that the Board of Health make this change known once it gets voted on in some sort of manner to the Nantucket Harbor watershed people. And if other people find out about it beyond them, okay, that's not going to be a problem. But okay, there it is. What date was that? That was in the December 19th meeting? Okay. Hence, that only underscores my point that I think I've been following this pretty darn closely. And somehow I missed that. And I, so here I am at a public hearing, wondering why I'm at a public hearing when it's already in place. But I think I have the answer now, because you've now changed it and added some more provisions, which I think are the correct ones. Thank you.
Thank you, Leslie. And then I know Bill was also on here. So Bill, you should be unmuted at this point.
Okay, I believe I'm unmuted now, much to my wife's chagrin, probably. Good afternoon. First off, thank you for tweaking this and putting these items actually into the policy that have been talked about. We're up to almost 500 members in our association, and through some fault of our own, because we're getting information out there, we've become the go-to for many of these seasonal homeowners, especially, but even some year-rounders. And so, while we tell them to contact the Board of Health directly, often they just keep coming back to us for interpretation, and then that's why you keep getting calls from the cranky old guy at F Street trying to find out what's up. So thank you for doing that. I'm assuming from what you said, but correct me if I'm wrong, that the implementation date of the testing for the conventional systems will be as of today, if you go forward with the vote, as opposed to when this rest of the stuff was previously enacted. Is that correct?
Yes, we would have to set up an implementation date because of the changes. So we'd have to set up a new implementation date, which would be as of today, as soon as we post it.
Okay, and then I get a little confused, which doesn't take much, but when you were talking about the signature page that's on there, is that who is in office at the 2017 timeframe or the 2019?
I believe that was the one that was on at 2017. The amendment for 2019 should have a second signature page already showing the adoption of the group that was there. So my apologies for it not being there.
All right, so let me ask. So that then leads to the whatever the document that was in. Oh, so this document actually comes from the last update was 2019. The 2019 amendment is embedded in this current document?
I believe so.
All right. Can you verify that at some point before, because it'd be kind of time consuming, a waste of time on the board's part.
Yes.
To have to reconvene if the one.
Yes, the draft that I worked off of for this specific meeting was actually the amended voted in amended version from the December 19th. So
Okay.
I can open them up one by one and we can see the changes in all three.
Okay. All right. Thank you.
Go ahead.
Art.
Yeah. Go ahead, Art.
Can you hear me?
Yes.
Okay. So in 5106B and 5107A and B, so it's easy to go to 5106, okay, B, it says replace with a tight tank or other innovative alternative system upon the following. The problem with just saying innovative alternative is we've got plenty of innovative alternative systems out there that do not have nitrogen approval. And we ran into this in the harbor watershed, people, Nantucket, people wanting to put in those systems, but the verbiage in the Nantucket harbor watershed says Department of Environmental Protection approved nitrogen reducing technology wastewater disposal system. So this will make sure, the whole reason we're doing it is for nitrogen reduction, that we're going to get nobody's going to be able to get around putting in a nitrogen reducing technology. So I think if we just added those to that verbiage to 5106B and 5107A and B, that would shore it up and remove just innovative alternative.
Art, sorry, I just realized my microphone was off. You said remove innovative alternative system and add nitrogen reducing.
Add Department of Environmental Protection approved nitrogen reducing technology wastewater disposal system.
And I capitalized those because it's a defined term under DEP.
Yeah. And so the same in 5107 A and B. And I think this thing is good to go. It's solid.
All right.
Yeah, that's good.
Roberto, it's Melissa. Where you just did that, the word system is repeated twice. You just want to remove the second one from each of those.
Gracias. All right.
This is Melissa again. What is the suggested new implementation date?
I would suggest effective immediately, mainly because this has already been in effect, and this just shores up what it is that we've been missing from before.
Any other comments or questions?
Yes.
Malcolm?
What is the prospect of timing-wise of sewers going in the Nantucket? Because we have been talking about this for 2 or 3 years, and I'm very much in favor of this. I've been quite vocal about it in the past, but if we look at last time we talked about this, I estimated that Nantucket had already spent $6 million on alternative design systems. The town's not going to do this for another 3 or 4 years. By the time we get this implemented, Nantucket will have spent close to what it would be to put sewers in. So that's just kind of illogical for me. I would wish someone from either Melissa or Roberto could comment on that.
Yeah, to my knowledge, sewer is a ways away, years, especially now with COVID taking such a huge chunk out of the budget.
That's what I'm afraid of here.
Yeah, and I'll just add to that, and I know you know this, I'm the newest board member on the select board, so I haven't had the privilege of having this conversation with the other board members, but just looking at COVID-related budget challenges, the PFAS that we're now going to go into executive session to talk about shortly, and other complicating issues. I can't say with any sense of confidence that sewer is even going to make the top 10 of the priorities in the next couple of years.
Yeah.
So if that's the case, I mean, Charlie talked about, we do have that 10-year grace period, talked about extending it for 20 years. At some point, can we talk about that again? Maybe make it 15, because, you know, I passionately believe we need to do this, but I just have a feeling like, I don't want to repeat myself, but by the time we get sewers, Nantucket probably could afford to put in 2 sewer systems with what they're going to spend.
We absolutely, we can put that on the agenda from even next month.
Could you put that on the, Steve, could you put that on the agenda for next month?
Yeah.
If we pass this today, I think we need to talk about some way to, however possible, maintaining our environment, but giving some financial break to the residents.
Sounds good. And then I believe, Charlie, I think you still have your hand up, and Leslie as well. So maybe we can do Charlie and then Leslie.
Okay, thank you, Vice Chair and members of the board. We appreciate your considering the extended grace period. These are very expensive systems, and it's pretty painful financially for folks to pay for an IA system, you know, say 8 years or even 10 years after they've just installed a Title V system. So we very much appreciate your consideration of this at your next regular Board of Health meeting.
Excellent. And Leslie, I think you're up too.
Yes, I too appreciate this and appreciate the suggestion that 15 years, and I'm going to take it out of just even the money thing. You want to reward the people who are good citizens, who take action to fix their septic, who maybe even do it just because they feel it makes sense to reduce nitrogen into the water. And so you really don't want to penalize the people who have done the right thing as of today. It may not be the right thing 15 years from now, but it's the right thing now. So don't penalize those people.
Absolutely. All right.
Is that it?
Would you like a motion to approve these edits or amendments?
We would need to close the public hearing first.
Okay.
That's what I was just going to ask. So
I move we close the public hearing.
I get a second.
I'll second.
By roll call vote, Jim Cooper.
Yes. Yes.
Meredith Lepre.
Yes.
Malcolm McNabb.
Yes.
Jim Cooper.
Yes.
Steve Visco says yes. Okay, public hearing is closed. So if you wanted, can I get somebody to make that motion to accept these amended verbiage to Regulation 51 and set an implementation date as of today?